from the station that's on your side. This is Channel 7 News Good Morning Arkansas.
Welcome back into Good Morning Arkansas, everyone. Today we are talking about a new clinic that focuses on the prevention and management of heart complications in patients battling cancer or those who are survivors of cancer. Joining us this morning to explain are doctors Ramey Marshell and Stephen Greer, both cardiologists with Baptist Health Heart Institute. Gentlemen, thanks for joining us. Dr. Greer, let's start with you because you had a very personal reason for discovering a need for this type of clinic. Can you share that with us?
Yes, ma'am. In July of 2019, I was diagnosed as having cancer involving one of my kidneys. And following surgery for removal of it, I started the same path that a lot of other patients do with an oncologist, a cancer doctor, and trying to decide if a chemotherapy was necessary or not. Went on chemotherapy for about 4 or 5 months, and in that time frame got to experience a number of side effects. And with that being the case, decided that it was time, if I was having this much trouble with it, there would be a lot of other people having it. And most of the side effects that we were dealing with were related to my heart, to my blood pressure control, and that sort of thing.
Wow, an incredible personal journey there of turning lemons into lemonade. So tell me exactly, why did you want to start this clinic then, and who are the appropriate patients for it?
Well, it's estimated there are between 5,000 and 10,000 new cancer patients diagnosed in Arkansas every year.
Wow.
Not to mention that with all the advances that they've had in the area of cancer treatment, so many more patients are now surviving and living longer with their cancer. This was an area of emphasis that the American College of Cardiology was starting to introduce. They had their own separate section of doctors who are interested in that. They have their own separate publication. And there was really a gap here in this area, in this community, for people that would do that. I mean, people are still seeing, cardiologists are still seeing the patients, but the follow-up is not as organized or as well coordinated as it ought to be in working in concert with their cancer doctors. And that's really what the impetus for the clinic was, the feeling that we could do better than what we were doing and that we were not serving the patients as well as we should.
Dr. Marshall, now you have special training in this area. Can you tell us more about how that special training will allow you to treat these patients?
Sure. Well, I'm originally from Arkansas, but had the pleasure to train in UAB or at UAB in Birmingham, Alabama. And I was very fortunate to have one of my mentors there who actually was formerly trained in cardiology, which, as Dr. Greer mentioned, it's an emerging field. So there still aren't many specialists out in the country, let alone training centers. So I was able to spend a lot of time with her getting formal training. But I also had the ability to get training in cardiac MRI, cardiac CT, and specialized echo techniques. And really what we have seen is that some of these advanced imaging techniques for cancer are really great ways for us to be able to follow people closely and pick up on potential cardiotoxic effects before they start causing symptoms. And so some of that training for me has kind of made me uniquely qualified and able to help care for some of these patients. And when I heard from Dr. Greer about the possibility of forming this clinic, it seemed like there was a huge need in Arkansas for it. So I was very happy to get doing it with him.
Absolutely. Dr. Greer, now this clinic isn't just for patients who are new to dealing with cancer, but also patients who might be dealing with the repercussions of being a cancer survivor. Can you explain that?
Well, we know that so many of the drugs that are used to treat patients with cancer have potential side effects that affect the heart, their blood pressure, a lot of the things that we deal with on a day-to-day basis as cardiologists. So what we try to do is not only get the patients who are new to cancer like I was, but patients who have already had exposure to these drugs. For some of them, it's going to be a lifelong follow-up because some of the side effects from their drugs may not show up for 5, 10, 15 years after they've had it. So what we want to do is try to intervene when we can with certain types of medications, certain types of treatments to prevent their heart from deteriorating or from them having side effects that could damage their heart from the drugs.
And Dr. Greer, if you quickly want to answer this, who are those patients who might be most at risk for heart side effects with cancer treatment?
Well, basically anyone who gets chemotherapy is the short answer for that. But in particular, patients who already have known cardiac problems, such as previous heart attacks, high blood pressure, heart failure, patients who have multiple risk factors, such as high blood pressure, high cholesterol, obesity, all the same things that we look for in patients who we try to screen for coronary disease. But there's one special group of patients that's really kind of gone uncared for in our country, and that's the pediatric cancer patients. For the children who had cancer like leukemia or lymphoma as a child and were treated with chemotherapy, their risk of developing cardiac disease is 5 to 10 times higher than the rest of the population. And for so many of them, it's like after they survive their cancer, they're just kind of never followed up after that. But that's another special group that we definitely want to include in our care and in order to prevent problems downstream.
Incredible work you guys are doing today. Dr. Marshall, if a patient is watching this and they'd like to be seen by you, how could they go about getting an appointment?
Well, they can get on Google if they can't remember the phone number. They can get on Google, type in Arkansas Cardio-Oncology, and the first link should be the Baptist Health webpage for our clinic. And from there, they can get the phone number. But the phone number is 501-227-7596. We'd be happy to get them scheduled within a few days.
All right. Dr. Marshall and Dr. Greer, thanks so much for telling us all about this clinic. Exciting work you guys are doing there. And for our viewers at home, that Baptist Health Healthline, if you'd like to call that, is going to be 1-888-BAPTIST, or you can go to baptist-health.com. All right, gentlemen, thanks again for coming on. We will have more Good Morning Arkansas after this.